Now, with the help of an AI-powered voice assistant, you can create your reports in seconds. See how easy it is. Imagine your daily routine this way. You finish the exam on your ultrasound device, for example, and right after pressing the attending the exam button on your device, the performing physician will receive a message via WhatsApp, email, or push notification. They can also configure the system to not receive these messages. Now, imagine another scenario. After pressing the End Exam button on your device, if any abnormality is detected in the exam, Lumini will inform you about this finding and ask if you wish to proceed with the diagnosis. Now let's see our system in action. Our system is compatible with DICOM technology, workless, store, and query retrieve. It supports exams such as MRI, CT scan, Holter, endoscopy, in any other medical or veterinary exam. It automatically recognizes and evaluates all exam information, including measurements and any other relevant data. We can also change the theme of our system. We have pre-set themes based on commonly used device brands, such as Mindray, Isauti, Philips. By default, our theme is Report Med. The software is available in all languages, and you can switch languages at any time. Reports can also be generated in any language. Discover our instructions feature. Lumini has the ability to learn information by following the instructions you provide. One example is our knowledge base section, where you can create a library of information for Lumini to learn from. You can provide scientific documents as a reference, allowing Lumini to study them and generate reports based on the information contained within these documents. You can import files such as Word, PDF, images, PowerPoint, or any document containing the information you want Lumini to learn. The document's content will be imported into the system, and Lumini will conduct an academic analysis to assist in generating reports. You can define your own reference measurement tables for Lumini to analyze and adjust reports based on the provided data. This is the system's logical structure. If Lumini detects a measurement outside the normal range, it will automatically adjust the report and update the findings according to the predefined instructions. Since Lumini is an AI, it generates text based on the knowledge it has acquired from user-provided data. However, you have the option to guide Lumini to use specific texts that match your daily reporting style. This ensures that your reports maintain their structure and formatting. If an abnormality is detected, Lumini will use your predefined texts instead of generating new ones. You can also teach Lumini the calculations you use daily, making report generation faster and more automated. Calculations can be based on exam measurement tables, standard values, or related data. As with other features, everything can be customized to your specific needs and preferences. You can instruct Lumini to perform a complete exam analysis and notify you of any detected pathologies. Lumini can also provide information based on the animal's breed or other characteristics and suggest relevant scientific articles related to the detected pathology. Understand the creation of reports. Simply click to start creating the report.
Hello, Dr. Souza. I have analyzed the exam for pet example and found some abnormalities. I have already updated the report based on these findings.
Lumini has already analyzed the exam measurements, the clinical complaint, and all the predefined conditions set by you, and has generated a report with the identified changes. What appears in green are the modifications made by Lumini. Now you can adjust them as needed. You can check all the measurements taken by your device by clicking this button. Now let's see how it works in practice. Lumini, left atrium in an altered state.
The modification was successfully made. The left atrium status has been updated to altered.
You can register phrases for Lumini to use in specific situations, ensuring she writes exactly as you would. Pulmonary hypertension in the right ventricle.
The modification was successfully made.
Any change you make, Lumini will detect and automatically update the report. See that the change was applied, and Lumini automatically added a diagnostic text. Are the texts too long? Don't worry. Just briefly tell Lumini the change you found, and she will take care of the rest. Pulmonary hypertension in the right ventricle.
The modification was successfully made. If you need anything else, I'm here to help.
You can also modify measurement values and teach Lumini the reference tables you use, so she applies them based on the values found in the exam. Here's an example. The AE/AO value is 2.9 and the weight is 38. See that the changes were applied, and Lumini automatically reformulated and added a text regarding the modification. Lumini can determine whether the information you're requesting is compatible with the animal's species, procedure, gender, breed, sterilization status, and more. She will alert you if you make a request that conflicts with this information. Here's an example. Lumini, the current pregnancy of this animal is 12 weeks.
It looks like there is a mistake. The example pet is a male, unneutered feline and is not pregnant. Pregnancy is a characteristic of females. If you are referring to a pregnancy evaluation for a female, we will need more information about the animal.
You can also instruct Lumini to suggest possible diagnoses when an animal presents with a specific pathology. Lumini, this animal has mitral insufficiency. Suggest some possible diagnoses.
Of course, mitral insufficiency can be associated with several heart conditions. Dilated cardiomyopathy, a condition in which the heart becomes enlarged and weakened, affecting left ventricular function. Degenerative valve disease, a common condition in dogs and cats that leads to the wear and tear of heart valves over time.
You can ask Lumini for suggestions regarding the current exam status. Here's an example. Analyze this exam and identify the main pathologies based on the available information.
Here are the main findings and identified pathologies. Mitral insufficiency. The animal presents with ACVIM B1 class mitral insufficiency, indicating valvular disease without cardiac remodeling or symptoms of left-sided congestive heart failure, CHF.
Lumini can detect if you have modified any text and assess whether it is different. It will then ask if you want to save that text for future reports.
I have identified a new text entry. Would you like to save it for use in future reports?
You can edit the phrase as you wish, and Lumini will fill in the text following your instructions. In the left ventricle, the change is, measurements are consistent with a decrease in ventricular diameter, suggesting subclinical dehydration.
Modification in the left ventricle has been applied. If you need anything else, I'm here to help.
Lumini learns from daily interactions and stores dictated text to use in future exams. You can also talk to Lumini, ask for suggestions, and get opinions about the exam. Lumini, perform a general evaluation of this exam and let me know if you find any relevant information.
Sure, here is a general assessment of the echocardiographic exam for the example pet. Primary diagnosis: the example pet presents mild mitral insuficiência, classificado como ACVIM-B1, indicando valvular disease without significant cardiac remodelação e sintomas de congestive cardiac failure. Left atrium, dilated, with the LA-AO ratio above normal. Left atrial enlargement suggests possible increased atrial pressure. Mitral valve, normal morphology with no significant regurgitation. The ELA ratio suggests some relaxation difficulties, which are common in geriatric patients. Right ventricle, no regurgitation observed. Size is normal. No significant pulmonary hypertension detected in the right ventricle.
Any recommendations?
Here are some important recommendations. Continuous monitoring due to suspected pulmonary hypertension associated with the right ventricle. Regular veterinary follow-ups are crucial for monitoring the animal's heart condition. Additional exams: consider further tests such as chest X-ray, BNP B-type natriuretic peptide levels, laboratory tests for kidney and liver function, blood tests to assess cardiac function. Daily care: maintain an appropriate diet rich in nutrients and low in sodium. Ensure adequate rest to avoid excessive physical exertion. Therapeutic recommendations. At the moment, no therapeutic recommendations or anesthetic contraindications are indicated.
We also offer the clinical history section. If a microphone is strategically placed during the consultation, Lumini will understand everything the pet owner and the veterinarian say, automatically filling in the entire clinical history. For example,
do you have any clinical complaints or family history regarding your pet?
Doctor, my pet's mother died of cancer, and the father has a history of heart problems. In the past few days, he has been vomiting excessively.
At this moment, Lumini has identified the conversation between the owner and the veterinarian and automatically filled in the relevant fields with the provided information. Let's now see how our billing feature works. Lumini, provide me with the billing report for December 2024.
Here is the billing report for December 2024. Total procedures, 9. Total amount due, $295. Vet clinic, 3 procedures, total 100. Vet pet life, 2 procedures, total $65. Vet saúde, 2 procedures, total $65. Final key insights. Highest amount due, $35 for a veterinary echocardiogram for patient Ravenna at vet clinic. Lowest amount due, $30 for a veterinary ultrasound for patient Max at vet clinic.
Now provide me with the billing report for vet clinic for December 2024.
Here is the financial report for December 2024 for vet clinic. Total amount due, $100. Number of procedures, 3. Average amount per procedure, $33. Highest amount due, $33 for a veterinary echocardiogram for patient Ravenna. Lowest amount due, $30 for a veterinary ultrasound for patient Max. If you need more information, I am available.
Generate a revenue forecast for the next 6 months.
Based on financial reports from December 2024 and January 2025, here is a revenue forecast for the next 6 months. December 2024, $100. January 2025, $120. Analysis and forecast. The average amount per procedure decreased from approximately $33 to $24, which may indicate an increase in the number of lower-cost procedures. If this growth trend in procedures continues, a reasonable estimate for the next 6 months would be an average revenue range of $110, $130 per month, considering the potential increase in procedures and a possible stabilization in the average charged amounts. If you need more details or adjustments, I am available.
The system is designed to integrate with all payment and billing platforms in any country. We use the latest payment processing technology and integrate with the best platforms for issuing tax receipts, fully automating the entire exam service cycle. Get to know our image editing feature. When you enter the image editor, you'll find several tools in the bottom menu. Let's start with the painting tool, which allows you to draw freely on the image. We can also add shapes, such as arrows, which can be colored to identify different types of lesions. Lines, rectangles, circles, and dotted lines. If needed, you can erase any created shapes. You can also add text to your images. When entering text mode, a text field will be created. Simply type the desired text and customize it by choosing text color, alignment, size, font style, and background color. Position the text wherever you prefer or where necessary. Other image editing options include resizing, rotating, flipping, adjusting the aspect ratio. You can also edit the image's color tones, including brightness, contrast, saturation, and other adjustments. Another editing option is applying filters. Simply select a filter and it will be applied to the image. If needed, you can also add blur effects to your image. Lastly, you have the option to add figures, such as emojis, to your image. Now, let's see how our final report will look. Lumini, print the final report.
The final report is being generated. Please wait a moment. The final report has been generated and is ready for submission. Would you like to generate the billing record for this exam?
Yes, please.
Billing record created.
The suggested report layout is 100% customizable, allowing the doctor to modify it as needed. Not only the layout of this report, but also the PDF-generated report. Everything is 100% customizable, allowing you to completely alter the structure. Here is an example. Thank you for your interest and the time you took to view our presentation.